Fenbendazole, also known as Panacur, is a common animal antiparasitic drug. But could it cure cancer? In this video, we're going to examine how cancer works, what the mechanism of action is of chemotherapy, how fenbendazole may be a candidate, and what the pros and cons of using something like fenbendazole to treat your cancer might be. People are looking at this both for treating human cancers and for treating animal cancers. But there's a lot to know, there's a lot of misinformation on the internet, and we're going to talk about what's real, what's not, and how this medication might be beneficial and may hold hope for the future. To understand why fenbendazole might affect cancer at all, you first need to understand what cancer actually is. Cancer isn't one disease, it's hundreds of diseases. But most cancers share a few core features. Cells stop obeying the normal rules. Normally, your body tightly controls when cells grow, divide, repair themselves, and die. Cancer cells essentially break those rules. They divide uncontrollably. They avoid dying when they should. They hijack nutrients and blood supply. And eventually they invade nearby tissues or spread elsewhere in the body. One major weakness of many cancer cells is that they divide rapidly, and that rapid division creates vulnerabilities. That's exactly what many chemotherapy drugs target. A lot of people think chemotherapy is basically just poison, and in a sense it is. But that description is incomplete. Chemotherapy is targeted toxicity. The goal is to damage cancer cells more than normal cells. Different chemotherapy drugs work in different ways. Some damage the DNA directly, some interfere with DNA replication, and some block signaling pathways. And some disrupt structures called microtubules. Microtubules are part of the internal skeleton of cells. They become especially important during cell division. When a cell divides, it has to separate duplicated chromosomes accurately. Microtubules help form the machinery that pulls those chromosomes apart. If microtubules stop functioning properly, rapidly dividing cells can't reproduce normally. They become damaged and die. This is how several legitimate chemotherapy drugs work, including drugs like vincristine and paclitaxel. And this brings us directly to fenbendazole. Fenbendazole is not an herb, it is not a vitamin, it's not a detox supplement, it's a pharmaceutical antiparasitic drug. Veterinarians commonly use it to treat intestinal parasites in animals. So how does it kill worms? Fenbendazole belongs to a class of drugs called benzimidazoles. These drugs bind to a protein called beta-tubulin that disrupts microtubule formation inside of parasite cells. Without functioning microtubules, parasites can't maintain normal cell structure, transport nutrients properly, or divide normally. Eventually, they die. And if that mechanism sounds familiar, it should, because disrupting microtubules is also a legitimate anti-cancer strategy. That overlap is exactly why researchers became interested in fenbendazole in the first place. Researchers noticed that fenbendazole and related drugs appeared capable of affecting mammalian cancer cells in laboratory studies. In vitro studies, meaning studies done in cell cultures or petri dishes, have shown fenbendazole can disrupt microtubules, slow cancer growth, and trigger programmed cell death in some cancer cells. There have also been some animal studies suggesting possible anti-cancer effects in certain situations. And importantly, the idea of repurposing drugs is not unusual. Researchers constantly investigate existing medications for possible anti-cancer properties. Sometimes it works, but this is where internet discussions usually go off the rails. Killing cancer cells in a dish is not the same thing as curing cancer cells in a living human being, or dog. Cancer cells are actually pretty easy to kill in vitro. Bleach kills cancer in vitro. Alcohol kills cancer in vitro. The challenge is killing cancer cells safely inside an actual patient without causing unacceptable damage to the rest of the body. That is a completely different problem. And this is where we have to separate different levels of evidence. Right now, most of the evidence for fenbendazole in cancer comes from laboratory studies, animal studies, case reports, and anecdotes. What we do not currently have is strong, large-scale human and animal clinical evidence showing fenbendazole safely and effectively treats cancer. And that distinction matters, because cancer is one of the easiest fields for false hope. People naturally want certainty, especially when they're scared. But many cancer treatments that looked extremely promising in early studies ultimately failed in real-world human trials. That does not mean the science around fenbendazole is fake. It means interesting mechanism and proven treatment are not the same thing. And internet discussions often collapse those into one category. Now at this point, some people expect doctors or veterinarians to just mock anyone interested in alternative therapies. I don't think that's helpful. Cancer is terrifying. Chemotherapy can be physically brutal. Cancer treatment is expensive. Healthcare systems often feel rushed, cold, and impersonal. So people look for hope. That part is understandable. But alternative doesn't automatically mean safe. Fenbendazole is still a biologically active pharmaceutical drug. And if it works against cancer at all, it's likely because it behaves similarly to chemotherapy by interfering with cell division. Potential risks can include gastrointestinal side effects, liver injury, drug interactions, and possibly toxicity from improper dosing or formulations. And one of the biggest dangers is when people delay or abandon proven cancer treatments while pursuing unproven alternatives alone. That can absolutely cost lives. So where does this leave all of us? Here's the most honest answer. Fenbendazole is scientifically interesting. There are plausible biologic mechanisms, there are laboratory studies showing anti-cancer activity, and it absolutely deserves further research. But there's a massive difference between this compound deserves more study and this is a proven cure being hidden from the public. Those are not remotely the same claim. Right now, the evidence is simply not strong enough to conclude that fenbendazole is a safe, effective, standalone cancer treatment for humans or animals. And using veterinary drugs without medical supervision carries real risk. If you or someone you love is dealing with cancer, the answer should not be blind trust in institutions. But it also should not be blind trust in internet anecdotes. Good science requires skepticism in both directions. And the reality is usually far more complicated than either side wants it to be. If you want more evidence-based breakdowns of controversial veterinary and medical topics, please subscribe. And if there's another topic you want analyzed scientifically instead of emotionally, let me know in the comments.